Hello, everyone, and thank you, Dr. Jenna, for being with us here today. We're going to cover a lot of topics, hopefully really rapid fire quickly. There's a lot going on in the coronavirus world, and so let's get going. First topic, what is the state of the world by region in the coronavirus?
Yep, that is a huge question, and I'm sure a lot of our employees are keeping up very closely on what's going on in their regions. Worldwide, we're seeing different prevalence rates of the virus spread, which is not really unexpected. If we break it down by the regions where CoorsTek has facilities, what we're seeing in Asia is that there has been actually quite good control over the virus, particularly in countries like South Korea, Japan, Hong Kong, certainly. Going over to Europe, where there are obviously other facilities, we're currently grappling with summer vacations and predictably increased spread related to that. And so we're watching Europe very closely to see where areas of spread are occurring. Here in the United States, based on our response to the virus, we're seeing widely variable rates of community spread, depending largely on which state you're in, urban density, and many other factors related to that. So to summarize, there's a lot of developments with prevalence and spread based on where you are in the world.
So let's just hit CoorsTek's stats real quickly. We've had 19 cases around the globe of coronavirus. We've had 0 cases in Asia. We've had 3 cases in Europe and the remainder here in the United States. In almost every case, those cases have come from outside, and so employees getting sick in their daily life. And so I think it's super important to remember the protocols that we have in place here at work are important, but they also work outside of our job, so let's keep that in mind. Especially in the United States, there's a wide range of how people are reacting to corona as far as safety protocols. Can you talk us through a little bit about what you recommend there?
Mm-hmm. Yeah, I mean, we're starting to see some pharmacological options come out, meaning things like medications, treatments, but what we know works right now is mainly the non-pharmacological interventions. So mask wearing is a big one. We do have data to support that. Keeping a good physical distance, and honestly, the more distance, the better, but we're saying at least 6 feet, and then really close attention to hand hygiene. We know that these measures work, and I think in a lot of areas in the United States, there's a sense of relaxation once you flatten the curve, but the virus is still very much active, and so it is important to remember what works and to be vigilant in practicing those measures.
So we're coming into fall season now, so it's back to school time, and I know school districts are all over the map in dealing with our kids and how they're planning on it. So please stay close with your HR business partner and your manager as you make plans for your students' return to school, and so we can kind of schedule and accommodate around all the different directions this thing could go. But let's turn to school safety now. How do we stay safe at school, at home?
The topic of school safety really has to come down to a few factors. The first is, what's your current community prevalence? I like to look at positivity rates, meaning out of all the tests you do, what % are positive? If that rate is above 5%, that to me suggests that there's going to be at least one child who's going to get sick in the school, and with what we know about the virus, it could spread quite easily. So community prevalence, I think, is a huge factor in this. And then you have to get down to district level safety. So what is your school district doing to keep your kids safe? Are they cohorting the kids in small groups? Are they letting them mingle with other classes? There should be a plan around children being cohorted into small groups to avoid contact with large amounts of other students. And then there's also the question of what happens if a child becomes sick. Do they have testing measures in place? Do they have contact tracing in place? That's a big deal from the school perspective. So I think, unfortunately, the onus is on parents to look at what the district's plans are and to bring their own judgment into whether that sounds safe to them or not. The other thing that you have to get into with this is your family's individual factors. So for example, if your child has something that's known to be a risk factor for severe disease, if they're immunocompromised, you really need to take that into consideration when deciding if going back to school is right for your child. We do know that being in school is associated with certain emotional, physical, mental well-being improvements for children. And so, if your child's not doing well with remote learning, that also has to be taken into consideration. And then the final question is, your family. Do you have grandparents that live with you that would be at increased risk? So getting to the bottom of it, there are a lot of things that parents and families have to take into consideration when looking at return to school, and it really comes down to your district and your community prevalence.
We're getting back into flu season again, and we also have the coronavirus. So can we talk a little bit about flu prevention, which is something that we do have, and then also how do we tell flu symptoms separately from coronavirus symptoms?
Yeah, this is going to be the question for the next few months. We start to see influenza or flu pick up in the fall months. Generally between October and February is when we see the peak in Northern Hemisphere. In terms of flu versus coronavirus, there are actually a lot of similarities. And so from the medical standpoint, we used to just diagnose people presumptively with flu if they would come in with a dry cough and a fever, and about 80% of the time we were right. Now that we have to worry about coronavirus outbreaks, we're going to have to actually test to confirm. So a lot of places are developing tests which will test for both influenza and coronavirus. Hopefully this will be a quick turnaround test. I know at UC Health where I work, we're working on a similar test, and nationally as well as internationally. In terms of the symptoms, you're going to see a lot of dry cough and fever with both. You'll see muscle aches with both. There is a bit of a difference in that coronavirus can cause a loss of taste and smell sensation, which is a bit more unique to coronavirus. So that's something that I would lean more towards a patient having coronavirus if they were to come to me with those symptoms. Getting into flu, there are two major types of flu. There's flu A and flu B. They both tend to have a combination of fever, cough, and muscle aches. Flu B has a little bit more of GI symptoms as well. But ultimately, I think it's going to come down to testing patients with a flu-like illness this year rather than saying we think you have the flu.
I also want to make a quick plug for Family for Families, familyforfamilies.org. This is our employee assistance program. If you've been affected by coronavirus, and I think we're taking a pretty broad look at that, consider applying online for assistance there. To close the loop, then, Dr. Jenna, on the flu, this is a treatable disease in many years. We can save a lot of lives, and so we're going to have, like every year, flu shots available at your location. So look out for that, please. This is a challenging time, but it's also a politicized time, even around the world. It's hard to know what sources of information to trust. And would you walk us through your thoughts on some sources that would be useful for us to know about, and what to look for when you're not sure about the source that you're looking at? Yeah,
I think that's a great topic. I think in terms of going over specific numbers rather than internalizing what you're hearing on the news, just go directly to the source. I really like the Johns Hopkins Coronavirus Tracker website. It breaks down by international region, continent, country, state level in the United States. It even gets down to county level. It's very accurate. They really keep up to date on it quite well. And so I enjoy looking at Johns Hopkins for numbers-based information. When we talk about therapeutics, treatments, and vaccines, the NIH has a nice website that brings together the best data that we have for each treatment. So there's a link to the NIH website for that I encourage people to go to.
All right, let's talk about what's new in Corona world. Both from symptoms and then treatments. What are we seeing?
Generally, young, healthy people do fine. We see a lot of the problems with people who are older, and that is still holding true. There has been quite a bit of media information around young kids who can get quite ill with something called multisystem inflammatory syndrome. That's actually very rare, but it is possible. So we are keeping a close eye on how that impacts children. In general, though, children tend to do well as you get older. So for example, from before the age of 10 to above the age of 10, you're more likely to get the virus, but still likely to do fine with it. We are seeing some increased severity in patients who are pregnant, patients who have diabetes, other cardiovascular problems, and then again in older patients.
So let's talk remdesivir.
Remdesivir was one of the first pharmacologic treatments that we saw some encouraging data for. We saw that patients who had coronavirus and were ill enough to be in the hospital had a quicker turnaround time or improvement time if they were on remdesivir. So as of right now, we are giving patients remdesivir when they're hospitalized and typically when they require supplemental oxygen.
What about hydroxychloroquine?
Hydroxychloroquine is a very hot button topic right now. I will say that we've known for maybe 2 or 3 months that patients who are ill enough to be in the hospital, they don't have improved outcomes with hydroxychloroquine. There was a recent study that showed that the same was true for patients with just mild illness. So personally, I'm certainly not taking it, and I'm not giving it to my patients based on this data.
Let's move into vaccines. So I know there's a lot of effort being done here, and it's hard to tell where we are. Can you help us with the state of the art?
Yeah, absolutely. So in terms of vaccines, as I'm sure all of our listeners have heard, there's something in the U.S. called Operation Warp Speed, which is essentially where the government is putting a lot of money into the most promising vaccine candidates. Worldwide, there are 8 vaccine candidates that are now in phase 3 trials, and these are large-scale clinical trials, usually above 10 to 20,000 participants. The ones that you might be most familiar with would be the Moderna vaccine out of Massachusetts. They're just starting a phase 3 trial looking at 30,000 patients, where about half of the patients will get the vaccine and half will get a placebo. And then, unfortunately, based on the fact that we have ongoing community spread, we are thinking that if there is a difference, that we're going to see it based on whether or not these patients have an immune response or become ill.
In closing, I think, in the words of our Korean colleagues, let's be each other's vaccine. But Dr. Jenna, can you give us a few parting thoughts to remember as we leave here?
Just remembering that this is still a very active, ongoing problem. I think there is a sense of relaxation that occurs once you see your individual areas curve flatten, you see less active cases. And I think another big component is, do you know anyone who's been sick with coronavirus or anyone who's had a bad outcome from it? And it can sometimes be hard to tell the impact that you can have on other safety if you are not personally familiar with it. But I would just like to remind employees here that we do know that some measures work, specifically the non-pharmacological measures. So, remembering to wear your mask, both to keep yourself safe and as a courtesy to others. Remembering, the importance of distancing, because we know how this virus spreads. And keeping that in mind, both at the workplace, obviously, with the protocols that you have in place, but also at home and when you're with family and friends. I understand that people are obviously itching to get out and vacation because, we're social beings. But it's really worth keeping in mind, are you going to be traveling to somewhere with a higher prevalence? And if so, perhaps reconsider or look at ways that you can do that very safely. We do have some sense of what works even as we await a vaccine. And so just keep in mind ways that you can keep yourself safe as well as your family and friends.
Well, thanks again, Dr. Jenna, for your time today, for your insights, and we look forward to talking to you soon.